Muscle injuries. Muscle injuries, often referred to as strains or pulls, occur when muscle fibers or the connecting tendons are overstretched or torn. These injuries can range from mild to severe, and they often result from sudden, forceful movements, overuse, or improper conditioning. Here are common types of muscle injuries and their characteristics. 1. Strain. Description: overstretching or tearing of muscle fibers or tendons. Symptoms: pain and tenderness in the affected muscle, swelling and inflammation, limited range of motion. Causes: sudden or forceful movements, improper warm-up, overexertion. 2. Sprain. Description: injury to a ligament, which connects bone to bone. Symptoms: pain, swelling, and bruising, limited joint movement. Causes: overstretching or tearing ligaments, joint trauma or impact. 3. Contusion, bruise. Description: injury to muscle fibers and connective tissue caused by blunt force or impact. Symptoms: pain, swelling, and discoloration. Possible muscle stiffness. Causes: direct impact or trauma. 4. Tendinitis. Description: inflammation of a tendon. Symptoms: pain and tenderness near the joint, swelling, gradual onset of symptoms. Causes: overuse or repetitive movements. Aging. 5. Muscle cramp. Description: involuntary and painful contraction of a muscle. Symptoms: sudden and intense pain, visible muscle bulging. Causes: dehydration, electrolyte imbalances, overuse. 6. Compartment syndrome. Description: increased pressure within a muscle compartment affecting blood flow. Symptoms: swelling, pain, and tightness, numbness or tingling. Causes: trauma or injury, overuse or repetitive activities. 7. Muscle contusion. Description: a bruise involving muscle tissue. Symptoms: pain, swelling, and discoloration. Possible muscle stiffness. Causes: direct impact or trauma. 8. Hamstring injury. Description: strain or tear in the muscles at the back of the thigh. Symptoms: pain, swelling, and tenderness, difficulty straightening the leg. Causes: sudden sprinting or stretching, lack of flexibility. 9. Rotator cuff injury. Description: strain or tear in the muscles and tendons around the shoulder joint. Symptoms: shoulder pain and weakness, limited range of motion. Causes: overhead activities, repetitive use. 10. Shin splints. Description: pain along the inner edge of the shin bone, tibia. Symptoms: pain during or after exercise, tenderness and swelling. Causes: overuse or stress on the shin bone. Treatment for muscle injuries: RICE method. Rest, ice, compression, and elevation to reduce inflammation and promote healing. Pain management: over-the-counter pain relievers may be recommended. Physical therapy. Rehabilitation exercises to restore strength and flexibility. Immobilization. Braces, splints, or slings may be used to restrict movement and aid healing. Professional medical evaluation. Severe injuries may require medical attention, including imaging tests and possibly surgical intervention. It's crucial to seek medical attention for severe or persistent muscle injuries to prevent complications and ensure proper healing. Following a gradual return to activity and incorporating preventive measures can reduce the risk of future muscle injuries.